what could be the role of shallow genomic sequencing in the diagnostics of myelodysplastic syndromes as a substitute of a complementary technique to cytogenetics. As you know, the karyotype is a very important prognostic parameter in MDS. And many MDS cases are characterized by genomic imbalances, gains or losses of chromosomes. Unfortunately, karyotyping is still a laborious technique which takes time and which still needs quite some human input from laboratory technicians and laboratory supervisors. So what we have addressed in the recent past, is whether shallow genomic sequencing can act as an alternative technique for addressing whether genomic imbalances are present in MDS and which imbalances are present in MDS. So what is shallow genomic sequencing? It's low coverage sequencing of copy numbers, and it allows to see whether copy numbers are increased or whether there are copy number abnormalities, copy number gains, copy number losses in a sample. And it's a technique which can be automated, where the readout is is much less difficult than analyzing a karyotype, and it could be a good technique to, let's say, it's a technique that can be applied on bone marrow, but it can also be applied on peripheral blood. So this is not yet validated in the diagnostic routine, but what we're looking at is whether maybe shallow sequencing of peripheral blood might act as a substitute for karyotyping and also could help in a differential diagnosis whether an MDS has copy number abnormalities or not from a simple analysis in peripheral blood. And analyzing peripheral blood by karyotyping in MDS is not a good idea. So it could help, it could be informative on the bone marrow status and the copy number abnormalities in the patients, but it is also a technique which is associated with less pain and less inconvenience for the patient.